Welcome to this presentation on stem cell therapy for wound healing, a groundbreaking approach to repair, regenerate, and restore difficult wounds. Wound healing is a complex, highly orchestrated biological process involving three phases: inflammation, proliferation, and maturation. These stages depend on the formation of new blood vessels, the delivery of oxygen and nutrients, and a cascade of growth factors. The burden of chronic wounds is enormous, with annual treatment costs exceeding $25 billion in the United States alone. Conditions like diabetes, obesity, malnutrition, and alcoholism contribute significantly to the challenge. Traditional treatments for non-healing wounds, especially in older patients, include correcting systemic issues such as blood sugar and cardiac function, local wound care, antibiotics, and in some cases, surgical reconstruction with grafts or flaps. Despite these efforts, clinical success remains moderate. In fact, every 30 seconds, an American with diabetes undergoes a foot amputation due to diabetic neuropathy. Clearly, we need a better solution. The key lies in achieving wound closure to prevent infection. While autografts, allografts, and biologic substances are already being used for non-healing wounds, they still face limitations. These include complications with angiogenesis, donor site morbidity, and immune rejection. The use of natural amniotic membrane in wound care began in the latter half of the 20th century. Initially applied to diabetic ulcers and post-surgical wounds, it gained attention for its regenerative potential. However, sourcing, processing, and storing amniotic tissue remained difficult until advancements were made in 2006. Enter amniotic fluid-derived stem cells, or AFS cells. These remarkable cells are multipotent, capable of high proliferation, and importantly, they lack immunogenicity. They also exhibit powerful immunomodulatory effects. By secreting a range of growth factors that support skin regeneration and angiogenesis, AFS cells are redefining what's possible in adult wound care. Mesenchymal stem cells, or MSCs, have been shown to promote wound healing in both animal models and clinical settings. Derived from placental membranes, MSCs stimulate healing in chronic wounds and have become a preferred source for tissue repair. Interestingly, some studies even point toward using cell-free, bioactive materials that mimic MSC function. This adds another layer of innovation to regenerative medicine. In a randomized, multicenter study comparing dehydrated amniotic membrane allografts to standard care in chronic diabetic foot ulcers, the results were impressive. ApiFix achieved a 97% wound closure rate within 12 weeks, significantly higher than both standard care and other advanced wound dressings. Even more striking, the cost of treatment with the amniotic membrane product was 4 times lower. Another randomized trial evaluated amnion/chorion membrane allografts in venous leg ulcers. At just 4 weeks, 62% of patients in the allograft group showed over 40% wound closure, nearly double that of the control group. The allograft group also experienced a dramatic 48% mean reduction in wound size, compared to only 19% in the standard therapy group. A comparative study of 65 patients with diabetic ulcers showed that ApiFix achieved complete wound closure in up to 95% of cases within 6 weeks. By contrast, Aplograf and standard care lagged behind significantly. ApiFix also delivered faster healing, a median of just 13 days, compared to 49 days for other options. These results reinforce the effectiveness of amniotic-derived therapies. In conclusion, stem cell-based products, particularly amniotic stem cell therapies, are setting a new standard in the treatment of chronic wounds like diabetic ulcers and venous leg ulcers. Even dehydrated forms of these products, which no longer contain live cells, have demonstrated exceptional clinical outcomes. This technology is not just promising, it's already transforming lives.